Get smart about pharmaceutical equivalents ciprofloxacin. Throughout history there has been a continual battle between human beings and multitude of microorganisms that cause infections and diseases. In his 1945 Nobel Prize lecture, Fleming himself warned of the danger of resistance and says, "It is not difficult to make microbes resistant to penicillin in the laboratory by exposing them to concentrations not sufficient to kill them, and the same thing has occasionally happened in the body, and by exposing his microbes to non-lethal quantities of the drug make them resistant." Resistance is the concern. Resistant organisms lead to treatment failure, increased mortality, resistant bacteria may spread in community, low-level resistance can go undetected, added burden on healthcare costs, threats to return to pre-antibiotic era. WHO about antibiotic resistance. On the 22nd of October 2015, WHO launched the Global Antimicrobial Resistance Surveillance System (GLASS). New data shows high levels of antibiotic resistance found worldwide. GLASS data shows antibiotic resistance among 500,000 people with susceptible bacterial infection in 22 countries. Centers for Disease Control, the CDC estimates that, each year, nearly 2 million people in the United States acquire an infection while in a hospital, resulting in 90,000 deaths. More than 70% of the bacteria that cause these infections are resistant to at least one of the antibiotics commonly used to treat them. According to CDC, avoid resistance by preserving antibiotics' usefulness. Complete the full course of the drug. Do not skip doses. Do not save antibiotics for later use. Do not take antibiotics prescribed for someone else. Talk with your healthcare professional before taking antibiotics. According to Antimicrobial Resistance National Action Plan Pakistan, May 2017. Antibiotic resistance is one of the major health crises in Pakistan due to following factors: unnecessary large number of registered products, approximately 50,000, self-medication in more than 50% of the population. Highest numbers of drugs are prescribed with more than 3 drugs per patient, and 70% of patients are prescribed antibiotics. Irrational and indiscriminate use is more common among general physicians (GPs) and public sector hospitals. Availability of over-the-counter (OTC) without prescription medications, especially antibiotics. To avoid resistance, it is important to take antibiotics which have same quality as Innovator brand. Cipesta, first pharmaceutical equivalent brand. For pharmaceutical equivalents, the brand should have same active ingredients, same dosage form, same route of administration, identical in strength or concentration. May differ in characteristics such as shape, excipients and packaging. Parameters of PE study include dissolution, breaking force, disintegration time and moisture. Results of Cipesta 250 mg tablet and 200 mg IV are as same as Cipesta 500 mg table. Upon reviewing the above-mentioned results, it is concluded that the results were found satisfactory, indicating that Cipesta brand is pharmaceutically equivalent to Innovator brand. Cipesta provides same efficacy as that of Innovator brand at half the price. Cipesta provides safety to the patients as it complies with the dissolution standards of WHO.